Heart disease refers to a group of conditions that affect how efficiently and how well the heart works. This takes the forms of diseases or conditions affecting the pumping or muscle function of the heart, diseases affecting the circulation or blood flow to the heart, or diseases affecting the rhythm and day-to-day heartbeat that the heart is associated with. Heart conditions, once they're diagnosed, there are effective treatment modalities available, but first we need to be cognizant and aware of the symptoms associated with heart disease. Now, heart disease, based on what can affect the heart in terms of the muscle, valves, or the day-to-day beating of the heart, can take the form of various presentations. Typically, most people complain of tiredness or fatigue that is kind of below their usual exercise capacity. So you get tired or winded pretty easily. You can have chest pain either at rest or when you try and do any form of activity. You can have leg swelling, shortness of breath on exercise or on minimal physical activity, and a sensation of the heart racing or irregular heartbeat from time to time, either at rest or on doing activity, lightheadedness or dizziness. Those are the typical features of someone that has heart disease. Now, if you have any of these symptoms, it's always wise to visit a physician to have yourself checked for these problems. A baseline physician evaluation would involve a history where the physician talks to you and gets more information of what symptoms you're complaining of and kind of highlights them and zones them into one particular category to be evaluated accordingly. The next step is to have a formal physical evaluation, and then we normally order tests to confirm our suspicion of heart disease. After we normally do our evaluations to diagnose heart disease, most causes are treatable, and treatable with medication and with lifestyle modification. Medications take the form of tablets you may take once or twice a day, and also in the form of lifestyle modification, such as taking a concerted approach to educate yourself about lifestyle, what lifestyle factors can do to heart disease. Now, of the major risk factors for heart disease, of which there are 6: high blood pressure, diabetes, high cholesterol, obesity, sedentary lifestyle, and also smoking. Those are the major risk factors for heart disease. If we can control the modifiable risk factors such as high blood pressure, obesity, smoking, we can, in a sense, treat heart disease effectively, those and prevent it from reaching an irreversible point. Now, if heart disease is left untreated, if you have high blood pressure for a long time, if you have high cholesterol for a long time that's not treated, you can eventually accelerate the process called atherosclerosis, which is buildup of plaque in the vessels, which eventually can lead to an irreversible condition where you have damage to the muscles of the heart because heart disease is left untreated for such a long period of time.